Hello, my name is Dr. Nicholas Cohen, and I'm here to share with you tips for people with GERD, GastroEsophageal Reflux Disease. GERD is heartburn that occurs usually after meals and more than twice a week. The first thing you should do, tip number one, is to see your doctor if you have GERD. GERD may indicate a more serious problem, especially if you have difficulty or pain with swallowing, unexplained weight loss, chest pain, choking, vomiting blood, or having dark colored stools. Your doctor can assess if you have simple GERD or if you have complications of GERD or something more serious. Tip number two, weight loss. If indeed you do have GERD, weight loss is one of the most effective ways for you to control your GERD symptoms. To find out if you are overweight and would benefit from weight loss, you can either ask your healthcare provider, or you can go online, Google BMI, that's Body Mass Index calculator. Put in your height and weight, and if your BMI is 25 or over, then you are overweight and you would benefit from weight loss in terms of your GERD symptoms. Tip number three, elevate the head of your bed. If you have heartburn that occurs at night, it's effective to raise the head of your bed to improve reflux symptoms. The way to do this is to put 6 to 8 inch blocks of wood underneath the legs of your bed on the head side of the bed. Or you can put a styrofoam pad that can be specially designed for this purpose underneath the mattress. It's important not to just use more pillows, as this creates an unnatural bend in your body which can actually worsen the symptoms of GERD. Tip number four is to stop smoking. People who smoking causes decreased saliva production, and saliva is important in neutralizing acid if it comes up from the stomach. In addition, smoking can also relax the lower esophageal sphincter, which is the valve that prevents acid from coming up from the stomach. And smoking can increase coughing, both of which can worsen the symptoms of gastroesophageal reflux disease. Tip number five is to avoid large and late meals. Large meals distend the stomach and can worsen reflux. Meals that are close to bedtime, or meals where you lie down soon afterwards, also make gastroesophageal reflux disease symptoms worse. So it's important to have small meals, and after you eat, wait at least 3 hours before lying down. Tip number six, cut back on foods that worsen gastroesophageal reflux disease. There are certain foods, when taken in excess, which relax the lower esophageal sphincter and make GERD symptoms worse. These foods are excessive caffeine, excessive alcohol, chocolate, peppermint, and fatty foods. Tip number seven, avoid tight-fitting clothing. Tight-fitting clothing can cause pressure on the abdomen, and this can force stomach contents into the esophagus. Tip number eight, chew sugarless gum or oral lozenges. Chewing gum or using lozenges can increase saliva production, and saliva is important for neutralizing stomach acids that can come up from the stomach into the esophagus. Tip number nine, you may need medication either over the counter or prescribed by your doctor if your GERD is not controlled by these lifestyle changes. There are 3 types of medications used to treat GERD. The least effective are antacids, and the most effective are proton pump inhibitors. In between are histamine blockers. Typical antacids are Tums, Maalox, and Mylanta. Examples of histamine, or otherwise called H2 blockers, are ranitidine, the brand name is Zantac, famotidine, the brand name is Pepcid, or cimetidine. The brand name is Tagamet. And examples of proton pump inhibitors are omeprazole, brand name Prilosec, esomeprazole, brand name Nexium, and lansoprazole. The brand name is Prevacid. Usually you can start with a more, a less effective treatment like an antacid, and if that doesn't work, you can go up to the H2 blocker, and then if that doesn't work, you can go up to the PPI, the proton pump inhibitor. Typically, if you're prescribed a proton pump inhibitor by your doctor, you'll take it for 8 weeks and then see if your symptoms are controlled, stop the proton pump inhibitor, and if your symptoms return within 3 months, then typically the proton pump inhibitor is continued for a long time. If your symptoms do not return within 3 months, then typically you can be stopped on your proton pump inhibitor, and you may only need it when your symptoms are worse. Tip number 10 is believe in yourself. Gastroesophageal reflux disease is a very common disorder, and through these lifestyle changes you can effectively manage your symptoms. So good luck with your reflux and have a great week. Thank you very much.